Hello everyone, my name is Sridipti Reddy Ramidi. Today I am here to discuss about my case study Quality Measures guided by Dr. Farooq Alimi. The source of the data for my case study is taken from the Centers for Medicaid and Medicare Services from the cms.government. This is the free site which allows the individual to go on to discover the different measures of an individual hospital. From this site, I have chosen HCAPS hospital for the different years. HCAPS is Hospital Consumer Assessment of Healthcare Providers and System Patient Survey, which is collected on yearly based but refreshed for every quarterly. For my case study, I used the data from 2015 to 2021. These are the measures that I have been chosen for my case study. The choice of these measures for this study is just to recognize the needs of the increase in the precaution before discharging of a patient. Here, the measure ID HCOM6YP describes patient who reported S were given information about what to do during the recovery, and measure ID H symptoms YP describes patient who report S they did receive written information about the symptoms to look after the discharge. The measure ID HCOM7A describes patient who had been understood their care before leaving the hospital, and the measure ID H recommended DY represents or describes the patient who had understood or about the care in the hospital and definitely recommend the hospital to others. And measure ID HCOM5AP describes patient who report that staff always explain about medicines before giving it to them. The hospital that I have been chosen for review for my case study is INOVA Fairfax Hospital located in Fairfax, Virginia. The provider ID or the facility ID of INOVA Fairfax Hospital is 490063. The Google rating for this hospital is 3.1, Yelp rating is 2.5, CMS rating is 5, and the overall rating for INOVA Fairfax Hospital is 4. These are the three competitors that I have been chosen for my case study. That is Virginia Hospital Center, MedStar Washington Hospital Center, and George Washington University Hospital. Here, Virginia Hospital Center located in Virginia, MedStar Washington, and George Washington are located at Washington. These competitors were chosen because based on the location and to get the idea about the quality of the care patients who are receiving in that location. The limitations that have been faced while doing this case study is inconsistency of data and unavailability of the data for specific years and also for specific measures. Here is our first X bar chart, first indicator, that is the comparison of patient satisfaction on information given during recovery before discharge of the patients. On the x-axis we can see different time periods, and on the y-axis it's like percentages. There was a slight trend that we can see in the year of 2020, but everything lies within the limit. Here comes second indicator, XMR chart. This is the comparison of INOVA Fairfax Hospital with its competitors of understanding care after discharge that they need to be taken. If you see the graph, there was in 2018 and 19, the measure is below the lower control limit, but again it had been came within the limit in 2020 and 21. Here is our third indicator by using a measure ID of H recommended DY. This graph shows the comparison of recommending the INOVA hospital in comparison with its competitors. In all years, the recommendation survey lies within the limit. The fourth indicator, here it's the comparison of medication understanding. Patients who reported that the staff always explained about the medicines before giving it to them were considered in different years. There was a slight trend in year 2021, which we can observe within the graph, which is below the lower control limit. Here is our fifth indicator, that is comparison of written information about possible symptoms after the discharge of the patient. In this measure ID, the data is available only for years of 2019 to 2021. We can see there was like in the year of 2020 and 2021, the measure is above the control limits. Finally, INOVA Fairfax Hospital is frequently honored for its quality and innovation. INOVA Heart and Vascular Institute within INOVA Fairfax is the primary site. This is the only cardiac hospital in the area with the best resources for the early detection, diagnosis, and treatment of heart diseases. Heart, lung, kidney, and pancreas transplant treatments are available through the extensive organ transplantation department at INOVA Fairfax Hospital. This is the sole level 1 trauma center in Northern Virginia, which is available at INOVA Fairfax Hospital to care for the most seriously injured patients. Thank you for your time.